All right, welcome to Unsafe Spaces. I'm Randy Cross. Give you a little bit of a heads up. This is going to be a different episode. And when I say different, I mean the segments won't be in different orders. There'll only be one segment, and that segment's going to be an interview. Because joining me today is going to be John Bardis. John is, he could be here for our sports section. He's a member of the National Wrestling Hall of Fame. John could be here from a political standpoint. I mean, you're the former assistant secretary at HHS, recently stepped down off that. You were a former member of the board at USADA. We could talk a little bit of anti-doping, both in the U.S. and in the world of sports around the world. But what we're here to talk about specifically today is sort of the current healthcare system, and specifically kind of Medicare and what's going on with that and how that's impacted what you've learned and how that's impacted sort of your world for the last 16 months or so.
Thanks, Randy. Thanks for having me.
No.
Yeah, it was an interesting experience, but it was also sort of an opportunity for me to round out access to some information and follow through on some work that we've done for many years, and that was to understand the flow of economics and the risks as well as the impacts of the Medicare program in the United States today. So it's probably no secret that healthcare cost has really been a problem for the average American today. The average family of four today has to spend about $21,000 out of pocket in copay and premium before they actually get any health care, which is really remarkable when you consider the average family of four has an income of just north of $63,000 or $4,000. So the impact of what the Medicare program has become and how it's structured is a real factor here in causing
the Medicare trustees report recently came out. You've obviously seen that and reviewed that. But we've got a slide here, our first slide, sort of an explanation for people out there is how this system really works. Can you kind of walk people through this?
Yeah, I mean, I'll give it my best shot.
Okay.
Healthcare has its complications for most of us, but
yeah.
The reality of the healthcare delivery system in the United States today is that it is regulated and ruled by statutes associated with the federal program Medicare, and which really started in 1965 under Lyndon Johnson. It was actually initiated under Roosevelt, but not enacted until 1965 under the movement of the Great Society with Lyndon Johnson. And at that point, there was a real challenge in the United States that hadn't been seen before, really, in large number in civil societies, and that was because of the elimination of infectious diseases. We had a large percentage of the American population now living into older ages. So putting that in perspective, the average life expectancy of a white male at the turn of the last century, the 1900 time frame, was about 46 years. Mm-hmm. So now, with the elimination of infectious diseases, great work, penicillin, we had an aging population. So we had a political and social problem on our hands, and the war on poverty in 1965 was really intended to address a number of these issues, including an aging and sick population of elderly patients.
Yeah. In studying this, looking back at several authors and books, I was intrigued that, Medicare and everything that came out of that, this whole idea was born a long, long time. It was actually initially to take care of soldiers that fought in the Civil War. They wanted to start a fund to take care of them, and then eventually their families, their survivors, people like that. And then they figured out, well, if we can do that, why not expand it to everybody? Now, it took them, almost a little less than 200 years, but almost 200 years to get that thing going.
Yeah, well, I mean, and I think you have political forces at various times in the history of the country who come across either major social or national or global problems that emerge, and the political will at the time sort of drives political thinking toward different programs, and we've seen that happen. So when we look at Medicare, the time had come where we actually had an enormous number of Americans, many of whom had either fought in World War I, been through the Great Depression, were the parents of World War II veterans, and had really helped build the country. And how were we going to respond to them, right? What was going to happen? And so Medicare was put into place. Fascinating, though, that the rules around it ultimately, at the end of the day, did not foresee the consequences that we're experiencing now. And let me just say, Medicare has done some great things. There are many, many elderly and over 65 individuals in this country who have benefited greatly from Medicare. But unfortunately, in these last years, Medicare hasn't changed much. And now we're suffering from rules that have probably become a bit outdated for our healthcare economy.
And rules, honestly, when it comes to the financial side of Medicare, that maybe were a little too pliable, they're a little too changeable, because it's not as simple as here's what's coming in and here's what's going out. Those rules don't always apply in this system, correct?
That's right. No, you're absolutely right. So Medicare started off in 1965, and the incentive behind it, right, was a cost-plus system, or otherwise known amongst us citizens, common folk, as fee-for-service. And so it basically required any provider of services that Medicare would pay to amalgamate their costs for providing these services, later under what we call CPT codes, which is just an acronym for a complex way to analyze it. But bottom line is, you would be paid for what you spent. So in 1965, there was no Office of Management and Budget, and in 1967, the Congress wanted to know, from a projection point of view, what Medicare's cost to the American people would grow to become by 1990. The task was put to the Senate Finance Committee, who did the analysis, and they projected that between 1965 and 1990, Medicare as a program would grow based on an aging population utilizing health care paid for by the federal government through payroll deductions, would grow 7 times. The reality of it is grew 67 times.
Wow.
We ask ourselves, how did the greatest single budget miss, financial projection miss, in the history of the country occur? I believe it occurred because the incentives drove us right in that direction. In other words, we said the federal government will pay you to provide health care to Medicare beneficiaries. And by the way, we are now setting the rules, the regulatory environment for all health care, not just Medicare, but the entire private sector. We set rules in place that incented both utilization, but most importantly, the establishment and the creation of cost.
Is part of the problem sort of our generation, if you will? Because my idea, I'm 64 years old. My idea of a 64-year-old man wasn't quite in a walker, but he was old. I don't feel old. I take good care of myself. You're in unbelievable shape. We work out all the time. We eat well. We're living differently. Is that part of the life expectation dragging out further and not really being allowed for in the model? Is that part of the problem?
No, it's a great question and a very wise one. You're right. Truth is, the average life expectancy of a male in the United States in 1965 was about 65. And today, that individual, white male specifically, is approaching sort of 77, 78. White females are over 80. So it doesn't take math wizardry to understand that the actuarial tables have been blown out of the water. The expectation of life now has gone way, way past 65. The risks associated with end-of-life care and the cost of it have become very high, given the fact that we've made real advancements in technology. And at the same time, right, we have paid for inpatient services that treat sickness as opposed to services, and there are some, like Medicare Advantage, but they're small in comparison in scale. But the vast majority of what we do don't pay for wellness, right? And that's true in the private insurance market as well. So we've created a vast economic an ecosystem today in the United States that in the healthcare ecosystem is $3.6 trillion. By itself, independently, would be the fourth largest economy in the world, surpassing Germany.
Wow.
Surpassed Germany in its size and scale about 18 to 20 months ago. But what it really means is that we spend about $10,700 per man, woman, and child in the United States for health care. The next closest Western nation spends about $5, right?
Okay, well, with those numbers in mind, and we were talking about this earlier before we started, it took this country 240 some odd years to accrue a $20 trillion debt. But Medicare and this system seems like the way they're steaming along, and you had mentioned earlier, they'll be close to $1 trillion in deficit. And we'll go to the next slide here, by around 2029.
Yes. Well, you raise a great point, Randy. I'm glad you brought it up. So what happens, that while Medicare set a cost-plus system in place, and let me just address this first, if I might.
Yeah.
And that is, we in the federal government have been outstanding through the Medicare trustees and through the management of CMS in reducing our pricing for procedures while utilization has risen. Even in the face of that, even through meaningful cuts to Medicare pricing, as the aging population has emerged and the way that we've incented the system to work, we are now staring straight down the barrel of massive deficits in Medicare that really start in 2029. So at the moment, we're spending about $700 billion a year in Medicare out of the $3.6 trillion. And we're about break even on the puts and takes. But by 2029, that goes away. And then, to your point, Randy, it goes away at an extraordinarily accelerating rate.
Right. That's the chart, the way it does slide away.
Yes.
For these deficits and the way that they build, where does this number come from? I mean, where does the negative number come from? For a brain that might just think cost, supply, demand, things like that, where does the negative come from?
The negative ultimately comes from the reality of us having a large aging population that's going to be a utilizer of Medicare, mm-hmm. and a relative shrinking workforce to that scale. So today, for example, Randy, the average worker has a liability contribution to the Medicare trust fund of about $4,000 per worker per year. By 2036, that liability is going to be $12,000 per worker per year. So let me just underscore that point. In 18 years, your children and my children, assuming they're working, will have a liability for Medicare beneficiaries alone, which is 3 times the liability that you and I carry today as workers. So it's simply an economic equation that is headed to a crash, quite frankly, to put it bluntly.
Let's go to the next chart too, because it's another one about deficits, and it's just Part A. And for those of you, there's Part A, there's Part B, there's C, there's D.
And A is the hospital trust fund. So
right.
for elderly beneficiaries who are Medicare beneficiaries, this is the cost of hospitalization. So what it points out is that we start running deficits really about 2029, and then those deficits get completely out of control and start to approach by 2090, just for the hospital trust fund, a cumulative total of over $35 trillion. You look at the entire Medicare program, that by 2090, this is, by the way, not speculation, this is the Medicare Trust Fund Trustees Report that just came out very recently for 2018. The cumulative deficit in 2090 for Medicare is $130 trillion. Right, that's, to your point, against a 240-year cumulative deficit for the entire federal government of 20.
Right. Wow.
So what this probably tells us, right, is that, one, the government goes bankrupt and the currency fails long before we get here.
Yeah, and what's the impact of that? Because that's something people don't hear about or don't talk about very often, and it's not discussed, but how vital our dollar is to how this world works financially.
So true. Well, first of all, the dollar is the reserve currency of the world. And what that basically means is that every major transaction between banks in the world occurs in U.S. dollars. That came about from the Bretton Woods Agreement of 1944. The result of the war caused Britain to go bankrupt. At that point in time, the British sterling pound was the reserve currency of the world. This was essential for America. And it was essential for the free world because America used those dollars through the Marshall Plan and rebuilt both Japan and Europe and started really what I would call the liberal global world order economically. And it worked. We not only helped rebuild these countries, but their economies were rebuilt. In doing so, you now have the European Union, which has an economy in total approximately the size of the United States. The United States is approximately a $20 trillion economy. Free trade was able to happen. In addition to that, America was able to play its role as the leader of the free world, right? Those dollars funded our Navy, for example, which is the prime force in keeping waterways open. 90+% of all physical international trade occurs on the seas. All banking transactions occur. And yet, as another example, when there's a bad actor in the world like North Korea, who is building an illegal nuclear program, and there are sanctions, when America finds out about a trade that shouldn't occur in the face of those sanctions, the reality of our Treasury Department's capacity to shut down any company that's doing business illegally is based on the power of that reserve currency. Mm-hmm. Meaning this, whoever that company is that's doing illegal work, illegal transactions, and their bank is given not only the shot over the bow, they're shut down. So that's just one example on global security. But at the same time, that U.S. dollar has given American consumers enormous advantages in international trade, the cost of goods, the capacity for prosperous living, and the growth of an economy that has made important promises to future generations.
So is it oversimplifying to say, in light of these deficits, in light of the harm to the economy in the future coming down the pike, sort of as go the U.S., so goes the world?
I think there's no doubt about that. There are those such as China who I am sure have thought this through and would love to see their currency become the next reserve currency, and there are papers out that discuss that or that have originated from China. Mm-hmm. But yes, this issue all by itself would most dramatically change the world. If the American currency, as the U.S. dollar, falls out of reserve currency status, all chips are thrown up into the air. Truth is, we don't know what will happen. We don't know if there would be an orderly transition. We don't know if it would create, because of the kinds of trade issues or lack of ability to follow through on promises that have been made by the United States government of the surety of the value of the dollar, what other assets would fall out of place as a result of it. We do know this. If that were to happen, clearly economically and quite possibly militarily, it would be a very unstable environment.
Well, let's go back sort of to our economy real quick.
Sure.
And I used the analogy last week. If our leaders knew there was a volcano, Yellowstone was going to blow in a year, or they looked out into the skies, into the heavens, and they saw an asteroid coming, they'd have a plan. They'd know that thing hits us, or that volcano explodes in X number of months. Here's our plan. Here's what we have to do. Why haven't we heard anything about this? And is there a plan in place to fix this?
Well, if there is a plan, Randy, I don't know of it. Certainly, that doesn't mean that
that's not a good sign.
But probably one of the fathers of this thinking was Pete Peterson. Pete passed away this last year. Brilliant individual, one of the founders of Blackstone. Mm-hmm. And you probably, when you go to Times Square and other places, but you'll see the debt clock. And I think Pete was the individual who ultimately thought that up, just so that it was in front of people on a routine basis to let them know what we were dealing with. Good thinkers, quality people have been talking about this for a while. The reality of it is it's turned into a clouded political fight, oftentimes between those who call themselves conservatives and those who don't. But the reality of it is this is real. This isn't a guess. This isn't going away. And it cannot be successfully addressed by spending more money. At some point in time, we have to change the system so that, one, we can begin to eliminate the growth rate of the debt. What these data show us is that no matter what the economy does, it is impossible for us to solve this particular portion of the future debt crisis without changing the way healthcare is paid for.
Let's go to the next slide, because it'll be an illustration again of the cost versus the Medicare trends and what those individual workers are going to pay. And you've talked about this. And the next one. Now, is this part of the problem as we see it as a certain, because if you would read across here, some of these things, one's inpatient, one's outpatient. But the cost of these procedures, whether it's Medicare, MEDI-CAL, or even commercial, which is full boat, kind of what people walking down the street are going to have to pay for things, this cost is incredible.
Well, you're right, and these are net prices. So what you're pointing to here, Randy, is a handful of inpatient procedures inside of a hospital,
right,
and a handful of outpatient procedures which happen either in doctors' offices or clinics.
Right.
And what this underscores is the vast difference in net prices paid by various payment programs. They range from Medicaid, which in this case is MEDI-CAL because this is California, a California example, Medicare, which is the elderly population, and various forms of commercial payment. And here's the key. Medicare has, as I mentioned before, set the rules for all payment. In other words, thou shalt do the following in order to be paid. Thou shalt do procedures and do fee-for-service care in order to be paid. Medicare reserves the right to reduce its price anytime it wants to. The Medicare trustees have done that for a period of 50 years, and specifically since 1983, when Ronald Reagan came into office, when his budget director, David Stockman, clearly recognized that Medicare in the forward 15 years could and would bankrupt the federal government if they kept it on its present path. What came behind them was DRGs. That came under the Reagan administration. This is where we saw the separation of private pricing versus Medicare pricing. In fact, the New York Times had an extensive article that appeared about 4 weeks ago in which the author said something happened around the mid-'80s where we saw costs get out of control, and they're talking of around commercial insurance costs.
Right.
This is what happened. The government set rules in place that absolved them from living by the costs that they were creating, living according to the costs they were creating. And so this DRG system then forced the rest of the industry to move in the direction of pushing these costs to the private sector. And so now today, to your point, as you look here, if you look at a spinal fusion, which we all know is typically involving a few screws and a plate for somebody who's had a spinal stenosis or some trauma to their spine, if you're under Medicaid, or in this case MEDI-CAL, that spinal fusion, the state will pay about $27,000 for that. If you're a Medicare beneficiary and have to have that procedure, this is net. This is not a guess. This is a real number.
Right.
Medicare will pay $44,000. The average Obamacare exchange patient will pay $129,000, and you and I, through our commercial insurance, net, this is best price commercial,
right,
we'll pay $147,000. This is under the same roof of the same hospital. And
same procedure.
Yeah.
Patient A, 2 hours later, patient B comes in.
Correct. So these costs that now get shifted to the private sector are the prime, in fact, they are the issue.
Where does that go? Where does that cost go?
It goes to American corporations, and now at an increasing rate of growth, it's been going to the worker. And so in order to preserve profitability, corporations had to find a way either to get their beneficiaries, their workers and their families in the game to manage healthcare costs, but more importantly for them, right, and I understand this having served as the CEO of a publicly traded company, if my healthcare costs are actually growing at a rate that's faster than my sales growth and my earnings, I have to do something to offload those costs. We didn't do that at our company, but many have had to. So if you look at the average S&P 500 company, 2 years ago, their top-line growth rate was about 1.5 points. Their bottom-line growth rate was about 6, which meant that they were getting their growth rate and earnings from efficiencies.
Right.
Some of those efficiencies were coming from passing cost to someone else, and healthcare costs have been a big part of that. So if your healthcare cost, because the federal government in and of itself is not paying for their fair share of it, is now increasing in the private sector in the 12% range, right, in your state, your workers are now bearing the vast majority of the burden of that increase. So this, Randy, is a prime reason why the average worker today has no disposable income. They're making choices between housing, automotive, college educations, and healthcare expenses. So the Affordable Care Act was actually a pretty benevolent idea, but it was a financing idea. One, that under these rules where costs continue to rise because it's the only way that you can get paid, was ultimately bound to fail. At the time that it was put into place, there was a social crisis emerging. There were 40 million uninsured Americans. Why? Because the cost being shifted from the federal sector to the private sector with rules that only would pay you if you spent money, right, were now so onerous, those cost increases were so onerous that 40 million people didn't have insurance because they couldn't afford it. The Affordable Care Act was a financing mechanism that took money out of one pocket, yours and mine, in corporations, to assuage this problem by paying for these health insurance benefits. The reality of it is at no time did it ever get to the core issue, which is how are we going to address cost? And why does the United States spend nearly $11,000 per person when advanced Western nations in Europe are spending in the $5,000 range and have pretty good health statistics? Now, let me just say, I'm not for socialized medicine. I believe in choice. Medicare beneficiaries have had choice. They can choose their doctor. They can choose their hospital. I think Americans prefer that. But does it make sense for us to spend $5,000 to $6,000 per year per individual more in the United States because we have that ability? I think there's a better answer here.
Yeah. Is the first proverbial, this problem, is the first proverbial bite of the elephant, do Medicare policies, does that price have to jump? I mean, how much does it have to go up, would you guess? Because we talked about yesterday, like I said, I'm 64. I'll be eligible for Medicare in about a year. It's a huge savings to me monthly.
Of course it is.
To turn 65.
It is.
And it's just something in my brain just doesn't compute. I love it. I love the fact that I'll pay less, but that money's coming from somewhere. Yeah.
And where the money is really coming from is it's coming from the private sector who's picking up the burden of your lowered price, your lowered premium.
Right.
In addition to that, the federal government isn't paying its fair share, and very soon, right, by 2029, on payroll taxes for Medicare, right, the reality of it is the federal government is going to take in less than they're spending. And because of the aging population and a scale of workforce is smaller than it needs to be, the federal government is going to start running giant deficits on a program that it doesn't pay its fair share of price for.
Is part of the solution in front of us? Is it something like, I don't know, a MEDI-CAL, a Medicare Advantage, something like that?
Yeah, I tell you what, I'm a big believer in Medicare Advantage because the incentive for providers and physicians who all want to do the right thing, we know these people, they want to do the right thing. There always tends to be, an attempt to point the finger at somebody doing the wrong thing. These are folks throughout the industry that have attempted to do it according to the rules. That's what they do. But yes, if you incented the providers or you paid the providers to actually manage your health, they certainly have the resources to do it. But today, this is the only way we'll pay them. Mm-hmm. Really, I mean, it's the vast majority. If it, it's depending upon each market, Randy, it's somewhere between 80 and 90% of their load. They get paid on a fee-for-service basis, so this is what they must do.
Right. This again is another example of the actual costs of services as we currently see them.
Absolutely. So you're pointing out, and this is one that will. This is a cost method that's used by a hospital here in the Southeast. They've spread all their cost. Now remember, they've been incented to create cost as well. Mm-hmm. They've been incented in health systems to build towers and add clinics and add ORs and so forth, right? So if you take these massive costs, which are not all necessarily 100% bad, we know that when a health system, say for example Piedmont, builds a hospital wing, there are jobs, construction jobs. More nurses are hired. More people are employed. So I don't want to say one's all good or one side of this is all good and the other side is all bad. But here's the reality. It's now put their cost, because those are expensive environments to do this kind of work. We know that hip replacements and knee replacements can be done on an outpatient basis. But their costs now fully loaded, in this case, you have a hip replacement, which is a $16,500 cost, right? Medicare is paying $11,500. So with a $16,500 internal cost, what then do they have to charge commercial payers and for the identical procedure in order to make enough money to cover the lower pricing that they're receiving from Medicare? $48,000.
Yeah.
Same institution, net. This is, by the way, the best commercial price, not the worst. The list price on this is probably $130,000 for you and I. If we didn't have insurance, we'd get a list price of $130,000. But our commercial insurance company, through our premiums, will pay $48,000 for what Medicare will pay $11,500 for. That makes no sense.
None.
If we consider America to be a free market economy that's based on transparency and then choosing quality and price as a measure for value, how does $48,000 compare to $11,000 in the same place? Right? I guess maybe when we go to Walmart or Sam's Club or whatever store, we might want the Medicare aisle if we can get it.
If you can get it.
Right.
So we have to rely on the same people that dug this hole to kind of help us get out of it? Or not the same people per se, but basically politicians. It's the professional politicians. And you just spent 14, 15 months in the swamp. How is that going to work? Can they be incentivized to make this happen? Because that's how they got into this problem.
Well, it's a great question. First of all, I don't have the political calculus to know, but I like what Warren Buffett said a lot, that if these politicians don't do their job to bring the deficit in line with expectations, that they should absolutely be ineligible for running again. The reality is that in an environment where those who have the money can influence those who can decide how much money you get, you're going to have a level of inactivity, political risk that people aren't willing to undertake. And so that's a problem for us. But here's the truth. We have a $20 trillion deficit, but by the mid-2030s, we'll be adding, just with Medicare, $300 to $400 billion a year, and eventually by the end of the 2030s, per year, it'll be $1 trillion a year. Right? It will dwarf anything we've ever done before from a deficit creation point of view. And so, to me, the time to act on this is getting shorter and shorter, but now is the time for us to bring this to the fore.
That's great. Now, this is a subject, and we will revisit this because there's other parts of this that I'd love to do another just 20, 30 minutes just on the small parts of this. But thank you for doing this.
It's my pleasure, and thanks for having me.
look forward to doing it more. And it's great to have you back.
Thanks so much, Randy.
All right, John. Thank you.
Okay.
Well, I want to thank John Bardis again for all the information, for a great head start and a heads up on everything having to do with healthcare and Medicare, and we will revisit that, I promise. Next week, back to the regular Unsafe Spaces. But until then, I'm going to remind you, where do you find us? Well, you find us in the same regular places you always find us. You find us on Twitter, you find us on Facebook, you find us on iTunes, you find us all over the place, or you go to randycross.com or unsafespacesusa.com. And if you have any suggestions about the segments, about a guest, about things we could do, things we shouldn't do, it's producer at unsafespacesusa.com. And as always, we got to say happy trails.
Happy trails until we meet again.
Who cares about the clouds when we're together? Just sing a song and think about sunny weather.
Happy trails till we meet again.